to be applied to specific areas or the entire face, typically 2 to 3 times weekly. They're left on the skin and provide significant exfoliation. These are powerful products best used by those with resilient, acne-prone skin who have already adapted to gentler salicylic acid products. Spot treatments apply high concentrations of salicylic acid directly to individual breakouts for targeted treatment. These are excellent for treating isolated pimples without exfoliating your entire face. Starting with salicylic acid requires a conservative approach. If you've never used it before, begin with a 0.5% cleanser or 1% toner used 2 to 3 times weekly. Use it for 2 to 3 weeks, assessing your skin's response. If your skin tolerates it well without excessive irritation, dryness, or sensitivity, you can increase frequency to daily use or switch to a higher concentration product. When applying salicylic acid toners or serums, use clean fingertips or a cotton pad to apply evenly across your face, focusing on areas prone to acne. Use about a nickel-sized amount for your entire face. Apply to completely dry skin. Applying to damp skin increases irritation. Allow the product to dry completely before applying other products. Some salicylic acid products are meant to stay on your skin indefinitely, while others are meant to be rinsed off after a specific time. Read instructions carefully. Common mistakes when using salicylic acid include starting with too high a concentration, using it too frequently, combining it with too many other actives, and failing to moisturize adequately afterward. Starting with 2% and using it daily will almost certainly cause excessive irritation, dryness, and peeling. You're much better served starting gently and gradually increasing. Never combine salicylic acid with benzoyl peroxide on the same evening initially. Both are exfoliating actives that can cause significant irritation if used together by someone whose skin isn't accustomed to strong treatments. Once your skin has adapted to each individually, you might combine them cautiously, but build up to this gradually. Salicylic acid makes your skin more sun-sensitive, not severely, but notably. Always use SPF 30+ sunscreen daily when using salicylic acid. This is not optional. Sun exposure can cause post-inflammatory hyperpigmentation in acne-prone skin, and salicylic acid increases this risk. Side effects of salicylic acid are generally mild and resolve with time or reduced usage. Dryness is common, particularly if you're using higher concentrations or frequent applications. Combat dryness by using a good hydrating moisturizer immediately after applying salicylic acid. Mild peeling is normal and actually desirable. It indicates exfoliation is occurring. However, severe peeling suggests you're using too much. Slight irritation and redness may occur initially but typically resolve within 1 to 2 weeks. Some people experience temporary worsening of acne as impurities are brought to the surface, but this purging phase is usually short-lived. Results from salicylic acid appear gradually. After 2 weeks of consistent use, you might notice smoother texture. After 4 weeks, you should see reduced comedones and fewer new breakouts. Most people see significant improvement after 6 to 8 weeks of consistent use. However, salicylic acid works best for comedonal acne, blackheads and whiteheads, and mild inflammatory acne. For severe inflammatory or cystic acne, combining salicylic acid with other treatments like benzoyl peroxide or prescription retinoids is often necessary. Salicylic acid is safe for long-term use. Many people successfully maintain clear skin using salicylic acid indefinitely as their primary exfoliation and treatment method. However, occasionally, skin can become desensitized to salicylic acid if used continuously for extended periods. If you notice that salicylic acid that previously worked well seems less effective, take a 1 to 2 week break, then resume using it. This often restores its effectiveness. Alternatively, you can rotate between salicylic acid and other exfoliants like glycolic acid to prevent desensitization. Guide 5. Benzoyl peroxide, Comprehensive Guide to Bacterial Killing and Inflammatory Acne Treatment. Benzoyl peroxide is one of the most effective and widely recommended acne treatments by dermatologists. Unlike salicylic acid, which primarily removes dead skin cells and excess oil, benzoyl peroxide specifically targets the acne-causing bacterium Cutibacterium acnes. Understanding benzoyl peroxide's mechanism, concentrations, and proper application is crucial for maximizing its effectiveness while minimizing side effects. Benzoyl peroxide works through a unique mechanism. It generates reactive oxygen species that directly kill bacteria. This is fundamentally different from antibiotics, which the bacteria can develop resistance to. Bacteria cannot develop resistance to benzoyl peroxide because it works through oxidative stress rather than targeting specific bacterial proteins. This makes benzoyl peroxide an invaluable tool in acne treatment, particularly since antibiotic resistance is an increasingly serious problem in dermatology. Beyond bacterial killing, benzoyl peroxide has anti-inflammatory effects, helping reduce the redness and swelling associated with inflammatory acne. It also has mild sebum-reducing properties and may help with some degree of comedone reduction, though it's less effective for this than salicylic acid. Benzoyl peroxide comes in concentrations ranging from 2.5% to 10%, with some over-the-counter products going up to 10% and prescription-strength versions available at higher concentrations. Interestingly, studies show that 2.5% benzoyl peroxide is roughly equivalent in effectiveness to 10% benzoyl peroxide. The higher concentration doesn't necessarily mean better results. It primarily means more potential for irritation. Therefore, it's prudent to start with 2.5% and only increase concentration if needed. Benzoyl peroxide comes in multiple product formats. Cleansers containing 2.5 to 5% benzoyl peroxide gently incorporate this ingredient into your daily cleansing routine. These are appropriate for maintenance or mild acne. Spot treatments allow you to apply high concentrations directly to individual pimples. Serums or leave-on treatments apply benzoyl peroxide across your entire face and are left on the skin. These can be used daily or as directed. Gels and creams are thicker formulations that may have different absorption characteristics depending on your skin type. Starting with benzoyl peroxide requires similar caution as salicylic acid. If you're new to benzoyl peroxide, begin with a 2.5% product, ideally in a cleanser format or spot treatment, used once daily. Most people find evening application easier than morning application since benzoyl peroxide doesn't require sun protection and can be easily washed off in the morning. After 1 to 2 weeks, assess your skin's tolerance. If you're experiencing mild irritation or dryness but your acne is improving, continue. After 2 to 3 weeks, if your skin tolerates the product well, you can increase frequency to twice daily or increase the concentration to 5%. Application technique is critical. Apply benzoyl peroxide to completely clean, completely dry skin. This is more important with benzoyl peroxide than with most other products. If your skin is even slightly damp, benzoyl peroxide will irritate more readily. Allow your cleanser to fully absorb and dry, then apply benzoyl peroxide. Use a small amount, about the size of a pea for your entire face if using a leave-on product, or a slightly larger amount for spot treatment. Apply gently, allowing the product to absorb fully before applying other products. Benzoyl peroxide has a particular drawback: it bleaches fabrics and hair. If you apply it to your face, it can bleach your pillowcase, bedding, towels, and hair. Many people apply benzoyl peroxide in the evening and wash it off in the morning with their cleanser to avoid this issue. If you apply it in the morning, be extremely careful not to get it on your hair, eyebrows, or any colored clothing. Some people apply it as a spot treatment right before bed, allowing it to work overnight before being washed off in the morning. If bleaching is a concern, you might prefer using benzoyl peroxide in a wash-off cleanser format where the contact time is brief. Side effects of benzoyl peroxide are generally more significant than salicylic acid. Dryness is very common, particularly with higher concentrations or frequent applications. Combat this by using an excellent moisturizer after applying benzoyl peroxide. Some people find that benzoyl peroxide dries their skin excessively even at 2.5% concentration. If this is you, try reducing frequency to every other day or using it only as a spot treatment. Irritation and redness are common, particularly when starting benzoyl peroxide or when increasing concentration. This irritation is usually temporary and subsides within 1 to 2 weeks as your skin adapts. However, if you experience severe irritation, dermatitis, or reactions, discontinue use and consult a dermatologist. Contact dermatitis to benzoyl peroxide, while rare, does occur. If you develop an itchy rash that doesn't improve with reduced frequency, you may be allergic. Discontinue use and inform your dermatologist. Many people experience acne purging when starting benzoyl peroxide, temporary worsening of acne as bacteria die off and impurities are brought to the surface. This purging typically lasts 1 to 2 weeks. If purging lasts longer, consult your dermatologist. Photosensitivity is not a significant issue with benzoyl peroxide like it is with some other acne treatments, but you should still use sunscreen daily for general skin protection. Benzoyl peroxide is particularly effective for inflammatory papules and pustules, the classic red pimples with white centers. It's less effective for comedonal acne, blackheads and whiteheads, where salicylic acid is superior. Many dermatologists recommend combining benzoyl peroxide with salicylic acid for comprehensive acne treatment. Use salicylic acid to address comedones and exfoliate, and benzoyl peroxide to kill bacteria and reduce inflammation. Results from benzoyl peroxide appear relatively quickly. Anti-inflammatory properties, reduces sebum production, minimizes pore size, and strengthens the skin barrier. At 4 to 5% concentration in serums or moisturizers, used daily, niacinamide provides noticeable benefits. It's also gentle enough to use with other actives without concern. Alpha-lipoic acid is a powerful antioxidant that penetrates both water and lipid layers of skin. It reduces inflammation, supports barrier function, and has some evidence for acne reduction through anti-inflammatory mechanisms. Alpha-lipoic acid is typically used in serums at 5% concentration, applied daily. It's generally well tolerated but can cause mild irritation in very sensitive skin. Ferulic acid is a plant-derived antioxidant that works synergistically with vitamins C and E for enhanced antioxidant protection. Ferulic acid also has direct anti-inflammatory effects. It's commonly found in advanced serums and provides additional antioxidant support beyond vitamin C alone. Resveratrol is a potent antioxidant from plants like grapes. It reduces inflammation and has some antimicrobial properties. While not a primary acne treatment, it provides useful antioxidant support. Resveratrol is often combined with other antioxidants in advanced serums. Bakuchiol is a natural retinol alternative derived from the babachi plant. It provides retinol-like benefits including increased cell turnover, collagen stimulation, and anti-aging effects without being a true retinoid. Importantly, bakuchiol doesn't cause photosensitivity or irritation like retinoids, making it suitable for very sensitive skin or as an alternative for those who can't tolerate retinoids. For acne specifically, bakuchiol is less powerful than tretinoin or retinol, but provides useful cellular turnover support. Salicylic acid analogues include beta-hydroxy acids beyond standard salicylic acid. LHF, lipohydroxy acid, is similar to salicylic acid but slightly milder, making it suitable for sensitive skin. These salicylic acid analogues provide exfoliating benefits with potentially less irritation than standard salicylic acid. Azelaic acid, beyond its use for hyperpigmentation, has direct acne-fighting properties. At 10 to 15% concentration, azelaic acid has antibacterial, anti-inflammatory, and anti-keratinizing effects. It's a versatile ingredient useful for acne, rosacea, and post-inflammatory hyperpigmentation simultaneously. Botanical extracts like tea tree oil, witch hazel, and green tea have mild antibacterial and anti-inflammatory properties. While weaker than pharmaceutical actives, they provide supportive benefits. Many skincare products combine multiple botanical extracts for cumulative benefit. These are generally well tolerated, making them suitable for sensitive skin seeking some acne support without strong pharmaceutical actives. Retinaldehyde, also called retinol, is a retinoid intermediate between retinol and retinoic acid. It's slightly stronger than retinol but weaker and less irritating than tretinoin. For those finding tretinoin too strong or seeking stronger benefits than retinol provides, retinaldehyde is an excellent middle ground. It's increasingly available in advanced skincare products. Encapsulation technology makes some ingredients more stable or less irritating. Encapsulated retinol, for example, releases gradually over time, reducing irritation while maintaining effectiveness. Similarly, encapsulated vitamin C remains stable longer and is less irritating than non-encapsulated forms. Time-release technology delivers ingredients gradually rather than all at once. This reduces initial irritation while providing extended benefits. Some treatments use time release to deliver benzoyl peroxide or salicylic acid gradually throughout the day. Polyhydroxy acids, PHAs, like gluconolactone and galactose are gentler exfoliants than AHAs and BHAs. PHAs have larger molecular structures that penetrate more slowly, making them suitable for sensitive skin or those who can't tolerate standard exfoliants. They provide exfoliating benefits with less irritation. Using cosmeceuticals strategically enhances your acne regimen. For example, you might use salicylic acid for exfoliation, benzoyl peroxide for bacterial control, then add niacinamide serum for sebum control and barrier support, followed by a hyaluronic acid serum for hydration and a moisturizer with peptides for skin support. This multi-ingredient approach addresses multiple aspects of skin health. However, avoid the trap of skincare complexity. More products don't automatically mean better results. Focus on core treatments: cleanse, treat with proven actives, moisturize, protect, then add supportive ingredients. A simple routine with proven actives beats a complex routine with unproven ingredients. Guide 28: Acne and Mental Health, Psychological Impact and Management Strategies. Acne's psychological and emotional effects are profound and often underestimated. Understanding acne's mental health impact and implementing strategies to manage the psychological component is essential for overall well-being during acne treatment. The psychological burden of acne is real and significant. Studies consistently demonstrate that acne causes depression, anxiety, reduced self-esteem, and social withdrawal in many sufferers. This burden is disproportionate to acne's physical severity. Even mild acne can cause substantial psychological distress, while severe acne might cause less psychological impact in individuals with resilient self-image. Visible acne, particularly on the face, affects how others perceive you and how you believe others perceive you. This perception, whether accurate or not, influences social interactions and self-confidence. Many acne sufferers report avoiding social situations, dating, or professional opportunities due to acne-related anxiety. Some experience body image disturbance and depression stemming from acne. The unpredictability of acne exacerbates psychological distress. Not knowing when breakouts will occur, having acne that doesn't respond to treatment despite best efforts, and experiencing setbacks after progress all contribute to frustration, helplessness, and depression. The search for the right treatment becomes emotionally exhausting. Acne's psychological impact justifies aggressive medical treatment even for acne that isn't technically severe by dermatological standards. If acne causes significant psychological distress, depression, or anxiety affecting quality of life, treatment should be pursued regardless of how many lesions you have. Your mental health is a legitimate reason for professional acne treatment. Several psychological strategies help manage acne-related distress. Cognitive reframing involves recognizing and challenging negative thoughts about acne. Rather than, "Everyone will think I'm disgusting because of my acne," reframe to, "Most people don't notice my acne as much as I do, and those who matter don't judge me based on temporary skin condition." This isn't denying acne reality but maintaining perspective. Social support is protective. Talking with friends, family, or support groups about acne-related stress reduces isolation. Many people are surprised to learn how many others have experienced acne and understand its psychological impact. Online acne support communities can provide connection and perspective from others who truly understand the experience. Professional mental health support is appropriate if acne causes depression, anxiety, or social withdrawal. A therapist can help with acne-related body image concerns, anxiety, and depression. Therapy combined with medical acne treatment often produces better outcomes than medical treatment alone for those with significant psychological impact. Dermatology-specific cognitive behavioral therapy, CBT, exists for conditions like acne where the medical component is intertwined with psychological factors. This specialized therapy combines dermatological education with psychological techniques for managing appearance-related anxiety and acne-related stress. If available, dermatology CBT can be particularly helpful. Mindfulness and acceptance-based approaches help by reducing the mental energy spent fighting against acne reality. Rather than, I shouldn't have acne, this is unfair, acceptance involves, I currently have acne, this is a medical condition I'm actively treating. I can't control its presence right now, but I can control my response. This reduces suffering while maintaining motivation to treat acne. Stress management is particularly important because stress worsens acne through multiple physiological mechanisms: cortisol production, inflammation increase, immune dysfunction. Therefore, reducing stress not only improves mental health but also improves acne. Meditation, yoga, regular exercise, adequate sleep, and enjoyable activities all reduce stress and support both mental health and acne improvement. Appearance-focused repetitive behaviors like mirror checking, skin picking, and comparing yourself to others on social media exacerbate acne-related psychological distress. Reducing these behaviors through deliberate practice improves mental health. Set limits on mirror checking, perhaps checking appearance once in the morning and evening rather than constantly throughout the day. Limit social media exposure, particularly platforms emphasizing appearance. Avoid picking at skin, which worsens acne and increases psychological focus on lesions. Goal setting around acne treatment provides hope and motivation. Rather than the vague goal, clear skin, set specific targets. I will consistently use my skincare routine for 12 weeks and reassess, or I will make a dermatology appointment this month, or I will reduce skin checking from 10 times daily to 3 times daily. These concrete goals provide motivation and measurable progress. Celebrating small improvements maintains motivation. Rather than dismissing minor acne improvement as insufficient, recognize it as progress toward your goal. Each step forward is worth acknowledgement. Professional treatment validation through dermatological consultation helps. Hearing from a dermatologist that your acne is treatable and that you'll likely achieve clear skin with appropriate treatment provides hope. This hope reduces the sense of helplessness many acne sufferers experience. Family and friend education about acne helps create a supportive environment. Explaining to loved ones that acne is a medical condition, not poor hygiene or personal failure, often shifts their perspective and increases support. Medication consideration for acne-related depression or anxiety should be discussed with a memory. Most people experience slight redness that resolves within hours. Superficial peels are appropriate for mild acne, texture concerns, and maintenance. Monthly superficial peels combined with home treatments provide excellent acne management. Medium-depth peels penetrate into the dermis, providing more dramatic results but requiring more recovery. These use higher acid concentrations, 35 to 50% glycolic acid, TCA at 25 to 35%, or combinations, and require 3 to 5 days of significant peeling and flaking. Medium peels are appropriate for moderate acne, significant scarring, and hyperpigmentation. Results are more dramatic than superficial peels but carry higher complication risks. Most people perform medium peels quarterly rather than monthly. Deep peels penetrate deeply into the dermis, providing maximum results but requiring significant recovery time. These use very high acid concentrations, TCA at 50% plus, or phenol. Recovery takes weeks, and results are essentially permanent in terms of skin transformation. Deep peels carry significant risks and are rarely performed for acne specifically, being more appropriate for severe aging or significant scarring. Most dermatologists reserve deep peels for carefully selected cases. Laser treatments use focused light energy to treat acne, scarring, and pigmentation. Different wavelengths target different structures. Ablative lasers, CO2, erbium YAG, remove skin layers through vaporization, providing maximum results but requiring weeks of recovery. Non-ablative lasers penetrate without removing skin, requiring less recovery but multiple treatments. Fractional lasers treat portions of skin, leaving untreated skin to support healing, requiring less recovery than full laser treatment. For acne specifically, fractional non-ablative lasers are most commonly used. These provide acne improvement through collagen remodeling and pore minimization without severe downtime. Typical treatment plans include 4 to 6 treatments spaced 4 to 6 weeks apart. Results appear gradually over months as collagen remodels. Fractional laser is excellent for acne scarring, pore size reduction, and texture improvement. Cost is typically $300 to $800 per treatment. Blue light therapy uses specific light wavelengths, around 415 nanometers, to kill acne-causing bacteria. Treatments are painless, require no downtime, and are suitable even for sensitive skin. Most treatment plans include 8 to 12 treatments performed twice weekly. Blue light is particularly valuable for antibacterial acne treatment without systemic antibiotics. Cost is typically $75 to $150 per treatment. Photodynamic therapy, PDT, combines a photosensitizing agent, topical aminolevulinic acid or methylaminolevulinate, applied to skin with subsequent light activation. PDT kills bacteria, reduces sebum production, and improves acne. Treatments are followed by 24 to 48 hours of photosensitivity and significant redness. Results are dramatic but require recovery time. PDT is reserved for severe acne resistant to other treatments. Radiofrequency, RF, treatments deliver radiofrequency energy deep into skin, stimulating collagen, reducing sebum production, and improving acne. Multiple treatments are necessary, typically 4 to 6 treatments spaced 3 to 4 weeks apart. Radiofrequency is gentle, requires no downtime, and is suitable for various skin types. Results include both acne improvement and skin tightening. Microneedling creates controlled microinjuries triggering collagen production and skin remodeling. For acne, microneedling improves scarring and texture. For active acne, microneedling isn't appropriate as it can spread bacteria. Once acne is controlled, microneedling helps with residual scarring. Typical treatment plans include 3 to 4 treatments spaced 4 to 6 weeks apart. Microneedling is relatively affordable, $200 to $400 per treatment, compared to laser treatments. Extraction treatments remove comedones professionally. Hydrofacial uses suction and infusion to extract impurities without harsh manual extraction. Regular professional extractions by experienced estheticians safely remove comedones impossible to remove at home. Some dermatologists perform extractions as part of acne management, particularly when comedones are resistant to topical treatments. Intralesional steroid injections treat individual cystic acne lesions directly. A small amount of corticosteroid is injected into the cyst, causing rapid deflation and healing within days. This prevents cysts from persisting weeks or months and dramatically reduces scarring risk. Cost per injection is typically $25 to $75. This is not a treatment for widespread acne but rather for occasional large cysts. When considering professional treatments, assess treatment suitability for your specific concerns. Is your issue active acne, scarring, texture, or some combination? Different treatments address different concerns. Realistic expectations are essential. Even professional treatments require multiple sessions and gradual improvement over months. Budget considerations matter. Professional treatments can be expensive. Discuss your goals, budget, and expectations with your dermatologist. Combination professional approaches often yield best results. Monthly superficial chemical peels combined with quarterly fractional laser treatments, for example, address multiple aspects of acne and scarring simultaneously. Your dermatologist can recommend an appropriate combination for your specific situation. Guide 16: When to see a dermatologist, recognizing acne severity and treatment failure. Knowing when to seek professional dermatological help prevents prolonged acne suffering, psychological distress, and permanent scarring. Several clear indicators suggest you should see a dermatologist. Severe widespread acne covering large areas of your face and body warrants dermatological evaluation. Extensive acne suggests a need for systemic treatment beyond what topical treatments typically achieve. Dermatologists can prescribe oral medications, hormonal treatments, or isotretinoin, Accutane, for severe cases. Numerous cystic acne lesions, particularly if they're large, painful, and prone to scarring, require professional intervention. Cystic acne rarely responds adequately to topical treatments and often requires intralesional steroid injections, oral antibiotics, or other systemic treatments. Treatment failure after 8 to 12 weeks of consistent appropriate treatment suggests your acne requires professional intervention. If you've conscientiously followed a good skincare routine with proven treatments like benzoyl peroxide, salicylic acid, and retinoids for 8 to 12 weeks without significant improvement, your acne likely requires prescription treatments or systemic medications. Rapid acne onset or sudden severe acne worsening in adults may indicate hormonal imbalances, medication side effects, or other medical conditions. Professional evaluation can identify underlying causes and recommend appropriate treatment. Women experiencing sudden severe acne should be evaluated for PCOS or other hormonal disorders. Acne causing significant psychological distress, depression, anxiety, or social withdrawal warrants professional intervention regardless of acne severity. Mental health impacts justify professional dermatological treatment. Acne with signs of infection, increasing warmth, swelling, pus drainage, fever, requires prompt medical attention. These signs may indicate infection beyond typical acne and require professional assessment and possibly antibiotics. Acne concentrated on your body, back, chest, shoulders, and resistant to typical acne treatments may indicate fungal acne or other skin conditions requiring professional diagnosis and treatment. Concerns about permanent scarring or hyperpigmentation justify professional consultation. Early professional intervention can prevent or minimize scarring through aggressive treatment or appropriate professional therapies. During a dermatology visit, be prepared to discuss your acne history, previous treatments tried and their results, family history of acne, recent lifestyle changes, menstrual history, if applicable, and medications or supplements you take. Bring photos of your acne at different stages if possible. Discuss your specific concerns, whether you're most worried about current acne, scarring, or overall timeline to clear skin. Your dermatologist can prescribe prescription-strength treatments unavailable over the counter. Prescription retinoids, tretinoin, adapalene, tazarotene, are more powerful than over-the-counter retinol. Prescription antibiotics, oral doxycycline, minocycline, or topical clindamycin, treat bacterial acne. Spironolactone manages hormonal acne in women. Isotretinoin, Accutane, is a last-resort powerful medication for severe acne resistant to other treatments. Your dermatologist can identify acne triggers specific to you and recommend appropriate prevention strategies. They can also recommend or perform professional treatments like chemical peels, laser therapy, or extraction that aren't accessible outside dermatology. Finding a good dermatologist matters. Ask for referrals from your primary care doctor, friends, or family. Check online reviews and credentials. During your first visit, assess whether the dermatologist listens to your concerns, explains treatments thoroughly, and seems genuinely interested in helping you. A good dermatologist-patient relationship improves treatment outcomes. Guide 17, Treating Rosacea, Seborrheic Dermatitis, and Other Acne-like Conditions. Several skin conditions mimic acne but require different treatments. Misdiagnosis leads to inappropriate treatment and worsening of the underlying condition. Understanding these conditions helps ensure proper diagnosis and effective treatment. Rosacea is a chronic inflammatory condition characterized by facial flushing, persistent redness, small blood vessels, and sometimes pustules. Unlike acne, rosacea typically doesn't involve comedones and occurs more commonly in adults over 30. Rosacea is triggered by heat, spicy foods, alcohol, stress, and certain skincare products. Treatment focuses on trigger avoidance and skin barrier repair rather than bacterial killing. Supplementation is safe for most people, though it can cause mild gastrointestinal upset and rare interactions with blood thinners. Plant-based omega-3, ALA from flax or chia, is less effective than fish-derived EPA/DHA. Probiotics as oral supplements have mixed evidence for acne. While probiotics support gut health and might support skin through gut-skin axis mechanisms, specific acne benefits aren't reliably demonstrated. Some people report acne improvement with specific probiotic strains, but individual variation is substantial. If interested in probiotics, quality products with documented effective strains are preferable to low-quality products, though quality doesn't guarantee benefit. N-acetylcysteine supports glutathione production and has anti-inflammatory and antioxidant effects. Some evidence suggests NAC might improve inflammatory acne. Typical dosing is 600 to 1,200 mg daily. NAC is generally well tolerated, though some people experience gastrointestinal upset. Spironolactone supplementation is sometimes discussed, but spironolactone is a pharmaceutical medication, not a supplement, requiring prescription. This isn't applicable for over-the-counter supplementation. Saw palmetto is a botanical supplement claimed to reduce DHT and support acne. Evidence is limited and mostly from prostate health studies rather than acne-specific research. Acne-specific benefits aren't well established. Red clover contains isoflavones with weak estrogenic effects, claimed to reduce androgen activity and improve acne. However, evidence is limited. Additionally, red clover might interact with hormonal medications. Spearmint tea supplementation has some evidence for hormonal acne reduction through weak antiandrogenic effects. Drinking 2 cups of spearmint tea daily for several months might improve hormonal acne modestly in some women. This is one of the few plant-based approaches with dedicated acne research, though evidence is still limited. Licorice extract is promoted for anti-inflammatory effects. Topical licorice has some evidence for skin benefit, though oral licorice supplementation for acne lacks strong evidence. Additionally, chronic licorice consumption can affect electrolytes and blood pressure. Selenium supplementation at moderate levels, 55 to 200 micrograms daily, might support skin health through antioxidant mechanisms. However, acne-specific benefits aren't well established, and excessive selenium causes toxicity. Important considerations for supplementation: supplements aren't regulated as rigorously as pharmaceuticals, meaning quality, purity, and actual content vary between brands. Third-party testing helps identify higher quality products. Supplements can interact with medications. Discuss supplementation with your healthcare provider, particularly if taking medications. Supplements take weeks to months to demonstrate benefits. Expecting rapid results leads to disappointment. Supplements work best supporting other treatments, not replacing proven acne treatments. Many people take ineffective supplements indefinitely while their acne worsens, when proven topical treatments would help. Finally, the supplement industry profits from marketing claims exceeding evidence. Skepticism is appropriate. Practical approach: implement proven lifestyle modifications, sleep, stress management, diet, and proven topical treatments first. If acne improvement plateaus, consider evidence-based supplementation like zinc, vitamin D, or omega-3s. Avoid high-dose, poorly studied supplements marketed with exaggerated claims. Guide 39: Acne in diverse skin types and ethnic considerations. Acne manifestation, treatment response, and complications vary across different skin types and ethnic backgrounds. Understanding these differences ensures appropriate, culturally informed acne management. Skin type classification using Fitzpatrick scale ranges from type 1, very fair, burns easily, to type 6, very dark, never burns. Acne occurs across all skin types, but manifestation and complication risks differ significantly. Post-inflammatory hyperpigmentation, PIH, is more prominent and persistent in darker skin types, types 4 to 6. While lighter skin types experience PIH that fades within 3 to 6 months, darker skin types often experience PIH persisting 6 to 12 months or longer. This makes PIH management particularly important for darker skin types. Aggressive sun protection, early treatment of active acne to minimize inflammation, and specific PIH treatments, vitamin C, azelaic acid, hydroquinone, are particularly important for darker skin. Post-inflammatory erythema, redness persisting after acne heals, is more prominent in lighter skin types, while PIH dominates in darker skin types. Understanding your skin type predisposes you to which complication helps target appropriate treatments. Acne scarring appears across all skin types, though manifestation differs. Hypertrophic scars, raised, thick scars, are more common in darker skin types, while atrophic scars, depressed scars, are more common in lighter skin types. Some darker skin types experience keloid scars, excessive scarring extending beyond original injury, requiring specific treatment approaches. Treatment tolerability varies by skin type. Benzoyl peroxide can appear white or chalky on very dark skin, making application inconvenient. Using micronized formulations or applying to clean, dry skin before any other products helps. Some people with darker skin prefer avoiding benzoyl peroxide entirely and using alternatives like salicylic acid or retinoids. Photosensitivity from retinoids and chemical exfoliants presents differently across skin types. While all skin types experience increased sun sensitivity, darker skin types experience more severe hyperpigmentation from sun exposure, making sun protection even more critical. Lighter skin types experience more severe sunburn from photosensitivity. Chemical peels require different approach across skin types. Superficial peels are generally safe for all skin types. However, medium depth and particularly deep peels carry higher complication risk in darker skin types, including post-inflammatory hyperpigmentation and abnormal pigmentation. Dermatologists experienced in treating darker skin types are preferable for deeper peels. Oral antibiotics don't significantly affect athletic performance at prescribed doses. Athletes can safely use oral antibiotics for acne without worrying about performance impacts. Spironolactone, if used by female athletes, is not banned in professional sports and doesn't directly affect performance, though it's a diuretic potentially affecting hydration. Athletes using spironolactone should ensure adequate electrolyte and fluid intake. Isotretinoin doesn't affect athletic performance. However, during isotretinoin treatment, skin is photosensitive and sometimes irritated, which might temporarily affect comfort during training. Otherwise, no performance impact. Retinoids don't directly affect athletic performance. Some concerns about sun-sensitizing acne treatments affecting outdoor athletes are legitimate. Sun-sensitizing treatments require extra sun protection for outdoor athletes. Using high SPF sunscreen that's sweat-resistant and reapplying frequently is necessary. Anxiety about acne potentially affecting performance is psychological rather than physiological. If acne causes confidence loss that affects athletic performance, treating acne improves performance through psychological mechanisms. Conversely, improved mental health from treating acne often improves athletic performance. The overall effect of treating acne in athletes is typically positive. Improved mental health, confidence, and well-being generally improve or maintain athletic performance. Guide 73, Acne Treatment Costs, Insurance Coverage, and Affordable Options. Cost of acne treatment varies dramatically based on treatments selected and whether insurance covers them. Understanding costs and coverage options helps make affordable choices. Over-the-counter topical treatments, salicylic acid, benzoyl peroxide, retinol, cost $5 to $30 per product and are usually affordable. These are often effective for mild to moderate acne. Prescription topical treatments, tretinoin, adapalene, azelaic acid, cost $20-$100 plus per month depending on insurance. Generic versions are often affordable, brand name versions cost more. Oral antibiotics, doxycycline generic, cost $10 to $30 per month typically, making them affordable. Oral isotretinoin can be expensive, $200-$500 plus per month, even though the generic is relatively affordable. However, insurance typically covers isotretinoin for severe acne, bringing costs down significantly. Without insurance, isotretinoin can be prohibitively expensive. Spironolactone generic is inexpensive, $10 to $30 per month, making it affordable. Oral contraceptives for hormonal acne range from $20 to $100 plus monthly without insurance, though many are quite affordable. Insurance typically covers at least some options. Professional treatments: chemical peels $150 to $300, laser $400 to $1,000 plus, microneedling $200 to $400, are expensive and insurance rarely covers them. However, they might be worth pursuing if home treatment's insufficient. Insurance coverage varies widely. Some insurances cover prescription acne treatments generously while others cover minimally. Checking your insurance coverage for your specific treatments helps plan. Dermatology visits cost $100 to $300 plus without insurance. Some dermatologists offer sliding scale fees for uninsured patients. Community health centers often provide affordable dermatology care. Affordable acne management strategies: start with over-the-counter treatments, use generic prescription medications if needed, ask dermatologists about patient assistance programs for expensive medications, consider community health center dermatology if cost is barrier, check insurance coverage before treatments. Many effective acne treatments are affordable. Cost shouldn't prevent access to basic acne treatment, though advanced professional treatments may be limited by budget. Guide 74: Traveling with Acne and Maintaining Treatment Consistency. Travel disrupts routines, and changes in water, climate, and environment sometimes affect acne. Planning ahead helps maintain acne treatment consistency while traveling. Packing acne treatments: bringing full-size bottles takes space and weight. Travel size containers, available at most pharmacies, help. Decanting products into smaller bottles also works. Ensure all liquids comply with airline regulations if flying. Jet lag affects sleep quality and can worsen acne through stress and hormonal disruption. Prioritizing sleep adjustment and jet lag management helps minimize acne worsening from travel. Different water quality in travel destinations affects skin. Hard water or heavily chlorinated water might irritate skin. Using bottled water for rinsing face, or adapting cleansing to account for different water, helps minimize water-related skin issues. Different climates affect acne. Traveling to humid climates from dry climates or vice versa might temporarily worsen acne as skin adjusts. Using moisture-appropriate products for the destination climate helps. Stress from travel worsens acne. Stress management during travel, exercise, meditation, sleep prioritization, helps manage stress-related acne worsening. Maintaining routine is important. Even if traveling, continuing your acne treatment routine helps maintain clarity. Making treatment part of your travel routine, like packing it with toiletries, helps ensure consistency. Some travelers experience travel acne from new environments, water, or stress despite normally clear skin. Understanding this is temporary and will resolve upon return helps maintain perspective. Professional treatments aren't practical while traveling. Continuing topical treatments and avoiding new triggering factors is realistic goal during travel. If traveling long-term, weeks or months, establishing local dermatology care if treatments need refilling helps maintain continuity. Guide 75: Acne in Specific Professions, Pilots, Surgeons, Healthcare Workers, and Others. Certain professions have acne-promoting environmental factors. Understanding profession-specific acne factors allows appropriate prevention. Pilots and flight crew experience repeated altitude changes, cabin air pressure, dry air, and frequent travel jet lag, all acne-promoting factors. Additionally, time zone changes disrupt sleep and stress levels. These workers benefit from aggressive acne prevention and hydration strategies. Surgeons and healthcare workers wear masks for prolonged periods, creating occlusion and friction-related acne under masks. The pandemic increased mask-related acne awareness. Prevention includes mask breaks when possible, changing masks frequently, keeping skin under mask clean and dry, and using non-comedogenic products. Chefs and kitchen workers are exposed to heat, steam, and splashing from cooking, increasing sweat production and skin irritation. Heat exposure worsens acne. These workers need frequent face cleansing and good ventilation when possible. Outdoor workers, construction, landscaping, etc., experience sun exposure, heat, dirt, and sweat, multiple acne-promoting factors. Aggressive sun protection and sweat management are important. Office workers with high stress loads might experience stress-related acne. Stress management helps. Sports coaches and trainers are often in hot environments with sweat and frequent manual labor. Prevention strategies similar to athletes apply. Makeup artists and beauty professionals might have acne from product exposure or allergic reactions. Using quality, non-comedogenic products and maintaining clean equipment helps. Understanding your profession's specific acne-promoting factors allows targeted prevention. Many occupational acne factors can't be eliminated, can't stop wearing masks as healthcare worker, can't avoid heat as chef, but adapting treatments and prevention to account for occupational factors helps maintain clarity. Guide 76, Acne Myths and Misconceptions, Separating Fact from Fiction. Numerous myths about acne cause misinformation and sometimes harm. Understanding common myths helps you avoid misinformation affecting your treatment. Myth: acne results from poor hygiene. Fact: acne isn't caused by dirty skin or poor hygiene. Gentle cleansing is important, but over-cleansing worsens acne. Acne results from follicular occlusion, sebum production, bacteria, and inflammation, not dirty skin. Myth: chocolate causes acne. Fact: chocolate itself doesn't cause acne. However, high-sugar foods, which chocolate often contains, might worsen acne in some individuals through blood sugar and insulin effects. Myth: greasy foods cause acne. Fact: eating fatty foods doesn't directly cause acne through dietary fat transfer to skin. Excess calories from any source might contribute to inflammation and acne, but greasy foods specifically aren't acne-causing. Myth: acne will go away on its own eventually. Fact: some acne improves with age, but many people experience persistent acne requiring treatment. Waiting for spontaneous resolution wastes years. Myth: toothpaste treats acne. Fact: toothpaste isn't appropriate for acne and contains irritating ingredients. While older formulations sometimes contain benzoyl peroxide in tiny amounts, modern toothpastes shouldn't be used on skin. Myth: picking acne helps it heal. Fact: picking worsens acne, spreads bacteria, increases inflammation, and dramatically increases scarring risk. Never pick acne. Myth: sunlight cures acne. Fact: while temporary UV-induced drying might make acne appear better briefly, Sun exposure actually worsens acne long-term through inflammation and post-inflammatory hyperpigmentation. Sunscreen is essential, not optional. Myth: all makeup causes acne. Fact: while some makeup clogs pores, many non-comedogenic cosmetics don't worsen acne. Appropriate cosmetic selection allows makeup use without acne worsening. Myth: acne only affects teenagers. Fact: adult acne is extremely common and can be more severe and treatment-resistant than teenage acne. Understanding that these myths are false prevents ineffective or harmful behaviors based on misinformation. Guide 77: Acne Treatment Resistance and When to Escalate Care. If acne doesn't improve despite appropriate treatment, several possibilities exist. Understanding why treatments fail helps guide next steps. Noncompliance is the most common reason treatments fail. Using treatments inconsistently, not using them as directed, or expecting results before adequate trial time has elapsed appears as treatment failure. Ensuring 8 to 12 weeks of consistent use before concluding treatment failed is important. Incorrect treatment selection for your acne type causes apparent treatment failure. Using treatments inappropriate for your acne type, for example, using salicylic acid for primarily inflammatory acne when benzoyl peroxide would be better, results in inadequate response. Inadequate treatment strength or frequency might result in insufficient improvement. Increasing frequency or concentration, appropriately, not aggressively, sometimes converts inadequate response to good response. Combination of multiple acne factors not addressed by your current treatment might cause inadequate response. Adding treatments targeting different factors improves outcomes. Underlying conditions, PCOS, other endocrine disorders, infections, causing acne might not be addressed by topical treatments. Seeking professional evaluation for underlying causes is appropriate. Barrier compromise from overuse of strong treatments sometimes appears as treatment failure, constant irritation rather than improvement. Taking a barrier repair break and restarting with gentler approach helps. When to escalate care: if single topical treatments haven't produced adequate improvement after 12 weeks, if your acne is moderate to severe from the start, if you have signs of hormonal acne, if you have deep cystic lesions, if acne is psychologically devastating. Escalating to professional dermatology care, combination treatments, or systemic treatments is appropriate. Professional dermatology can identify why treatments aren't working and recommend appropriate escalation. Don't tolerate inadequate acne improvement indefinitely. Professional help exists. Guide 78: Post-acne skin health maintenance and prevention of future problems. After achieving clear skin, maintaining skin health beyond just preventing acne ensures long-term skin quality and prevents premature aging. Sun protection remains essential post-acne for preventing aging and ensuring any residual hyperpigmentation doesn't worsen. Sunscreen habit established during acne treatment should continue indefinitely. Barrier health maintenance prevents irritation and premature aging. Continuing appropriate moisturizing even post-acne supports barrier function. Regular exfoliation at appropriate frequency maintains skin clarity without over-exfoliating. Many people benefit from continuing gentle exfoliation, perhaps reduced frequency from treatment levels, long-term. Antioxidant skin care, vitamin C, green tea, others, support skin health beyond acne treatment. These can be incorporated post-acne for anti-aging and general skin health. Retinoids continue providing anti-aging benefits beyond acne treatment. Many people maintain retinoid use specifically for anti-aging rather than acne. Hydration remains important. Maintaining good hydration habits supports skin health long-term. Regular professional skin care, facials, peels, or other treatments, helps maintain skin quality and address any minor concerns before they become problems. Guide 79, Acne Education and Advocacy, Reducing Stigma and Improving Understanding. Acne stigma and misinformation continue affecting people with acne. Education and advocacy help reduce stigma and improve treatment access. Education about acne as a medical condition, not hygiene or lifestyle failure, reduces shame. Educating others. Severe, extensive scarring might warrant multiple treatment types performed sequentially. Realistic expectations are essential. Most scars can be significantly improved but rarely completely eliminated. Even after multiple treatments, mild scarring typically remains. However, significant improvement is usually achievable with appropriate treatments. Guide 13, Face Masks and Professional Facials for Acne Management. Face masks and professional facials supplement your daily skincare routine, providing concentrated treatments and professional expertise. Understanding various mask types and facial treatments helps you select appropriate options for your skin concerns. Clay masks absorb excess oil and impurities, making them ideal for oily, acne-prone skin. Green clay and kaolin clay are particularly effective. These masks draw out sebum, bacteria, and impurities from pores. Use clay masks 1 to 2 times weekly for 10 to 15 minutes on clean skin. Apply evenly, avoiding the eye area. As the mask dries, you'll feel slight tightening as oil is extracted. Rinse with lukewarm water and follow with moisturizer, as clay masks can be drying. Sheet masks infused with acne-fighting ingredients like salicylic acid, tea tree oil, or niacinamide provide targeted treatment and hydration simultaneously. Apply sheet masks to clean skin for 15 to 20 minutes, then remove and pat remaining serum into skin. Use 2 to 3 times weekly. Sheet masks are convenient, mess-free, and come in numerous formulations targeting specific concerns. Hydrating masks with hyaluronic acid, glycerin, or ceramides balance skin and prevent overdrying from acne treatments. These masks are essential if your acne treatment regimen is causing excessive dryness. Use hydrating masks 1 to 2 times weekly, particularly on days when you're using strong actives like retinoids or chemical exfoliants. Mud masks similar to clay masks draw impurities from pores while providing mineral content. Some formulations include additional active ingredients. Use similarly to clay masks, 1 to 2 times weekly for 10 to 15 minutes. Charcoal masks draw impurities from deep within pores. While popular, they can be overly drying. Use sparingly, perhaps monthly, if you have very oily skin. Avoid if your skin is dry or sensitive. Overnight masks are left on overnight and act as intensive treatments. Some are essentially very rich moisturizers, while others contain actives like retinol or acids. These work well for providing intensive treatment without time constraints. Apply as your final nighttime step and sleep with the mask on. Spot masks apply highly concentrated treatments to specific areas rather than your entire face. These are useful when some areas are more problematic than others. Apply to clean skin and leave on as directed. Important mask principles. Never use multiple mask types on the same day. Choose one mask per skincare session. Always follow mask application with appropriate moisturizer, as masks can be drying. Start with masks once weekly, increasing frequency only as your skin demonstrates tolerance. Don't leave masks on longer than recommended. Longer application doesn't mean better results and risks overdrying. Masks are supplements to your core routine, not replacements for daily cleansing and treatment. Professional facials go beyond at-home masks, utilizing professional strength products, specialized equipment, and esthetician expertise. A typical acne-focused facial includes cleansing, exfoliation, extraction, treatment mask, and moisturizer application. The extraction component, professional removal of comedones, provides benefits impossible to achieve safely at home. Hydrofacial uses suction technology to extract impurities from pores without harsh manual extraction. A spiral tip applies suction while simultaneously infusing treatment serums. Hydrofacials provide immediate visible improvement, particularly for comedones. Most people see results after a single treatment, with cumulative benefits after 4 to 6 treatments performed monthly. Chemical peel facials use professional strength acids, glycolic acid, salicylic acid, or lactic acid, to exfoliate multiple skin layers. Superficial peels cause mild redness and slight flaking but require no downtime. Medium peels cause more significant exfoliation and require several days of recovery. Chemical peels improve acne, texture, and hyperpigmentation significantly. Monthly superficial peels or quarterly medium peels provide excellent results. Blue light therapy facials use specific light wavelengths to kill acne-causing bacteria. Blue light, around 415 nanometers wavelength, is particularly effective against Cutibacterium acnes. Treatments typically last 15 to 20 minutes. Most treatment plans include 6 to 8 sessions, sometimes combined with red light therapy for inflammation reduction. Blue light therapy is particularly valuable for those seeking non-chemical treatment or for bacterial acne resistant to other treatments. Microdermabrasion facials use fine crystals or a diamond tip to physically exfoliate skin. This removes dead skin cells, unclogs pores, and stimulates collagen production. Results are immediate visible skin smoothing. Regular microdermabrasion, monthly, maintains clear skin and improves texture. Oxygen facials infuse pressurized oxygen with serums deep into skin. While marketed aggressively, evidence for exceptional benefits is limited. However, many people report improved hydration and glow after oxygen facials. Dermaplane facials use a sterile blade to remove fine facial hair and dead skin cells. This provides exfoliation and hair removal simultaneously. Results are immediate, smooth, bright skin. However, dermaplane isn't appropriate for acne-prone or actively inflamed skin, as the blade can irritate lesions. Laser facials use laser technology for exfoliation, collagen stimulation, and targeted treatment of specific concerns. Fractional laser facials are gentler than full laser resurfacing and provide results with minimal downtime. Professional facials are most effective when combined with consistent home skincare. Monthly professional treatments combined with daily home routines yield better results than either approach alone. Professional treatments accelerate improvement and address concerns beyond what home treatments achieve. Frequency of professional facials depends on your skin concerns and treatment type. Most people benefit from monthly treatments initially, then maintenance every 4 to 8 weeks once acne clears. Discuss appropriate frequency with your esthetician or dermatologist based on your skin condition and treatment response. Professional facials can be expensive, but the results often justify the investment for moderate to severe acne or significant scarring. Many dermatology offices offer facials at reasonable costs compared to standalone aesthetic spas. Guide 14, Diet, Nutrition, and Lifestyle Changes for Clear Skin. While skincare products are essential for acne management, what you consume and how you live profoundly affects your skin. Understanding dietary and lifestyle factors allows you to address acne from internal and external angles simultaneously. High glycemic foods spike blood sugar rapidly. When blood sugar spikes, acne resistant to standard topical treatments, particularly if inflammatory and deep, often reflects hormonal causes. Women with other hormonal symptoms, irregular periods, excessive hair growth, hair loss, fertility issues, should definitely pursue hormonal evaluation. Primary hormone involved in acne is androgen, particularly testosterone and DHT, dihydrotestosterone. However, most women with hormonal acne have normal total testosterone levels but exhibit heightened skin sensitivity to androgens. This explains why some women with normal hormones still have significant hormonal acne. It's about skin sensitivity, not absolute hormone levels. Relevant hormonal tests for acne evaluation include total testosterone, free testosterone, calculated or direct measurement, DHT, dihydrotestosterone, DHAS, dehydroepiandrosterone sulfate, LH, luteinizing hormone, FSH, follicle-stimulating hormone, and androstenedione. These tests assess androgen status and ovulatory function. Additionally, tests for other hormones affecting acne include estradiol, progesterone, tested in luteal phase for ovulation confirmation, cortisol, for stress-related endocrine effects, and thyroid function, TSH, free T4, may be relevant. Ovulatory dysfunction, present in conditions like PCOS, contributes to hormonal acne. PCOS involves elevated androgen production, irregular ovulation, and insulin resistance. Women with PCOS typically have irregular periods, acne, hirsutism, excessive hair growth, androgenetic alopecia, pattern hair loss, and often obesity. Testing for PCOS is appropriate for women with these symptoms. PCOS diagnosis requires ovulatory dysfunction, irregular periods, plus hyperandrogenism, elevated androgens or clinical signs, and/or polycystic ovarian appearance on ultrasound. Baseline hormonal testing during the follicular phase, first 7 days of menstrual cycle, is standard because hormone levels are more stable and baseline during this phase. FSH and LH are assessed during the follicular phase. Progesterone is tested during the luteal phase, typically 7 to 8 days after ovulation, to confirm ovulation occurred. Testing hormone levels at the wrong cycle phase produces misleading results. Understanding test results requires expert interpretation because normal ranges vary widely and what's normal for general population might indicate androgen excess relative to individual baseline. A testosterone of 50 ING/DL is normal for most women but might represent significant elevation for a particular individual. Free testosterone is often more clinically relevant than total testosterone because it represents the active hormone, though measuring free testosterone is technically challenging and prone to error. Elevated DHAS, particularly if greater than 350 μg/dl, suggests adrenal androgen excess and warrants further adrenal evaluation. Elevated androstenedione suggests adrenal or ovarian androgen production. Elevated LH with normal or low FSH suggests ovulatory dysfunction characteristic of PCOS. If hormonal testing reveals significant androgen excess, additional testing might assess the source. Adrenal tumors or ovarian tumors very rarely cause acne but can cause very severe hyperandrogenism. Evaluating clinical presentation helps distinguish adrenal from ovarian sources. ACTH stimulation testing can differentiate adrenal from ovarian androgen excess if warranted. Interpreting results in clinical context is essential. You might have borderline elevated testosterone with classic hormonal acne, jawline breakouts, cyclical pattern, making hormonal treatment appropriate despite normal lab values. Conversely, you might have elevated testosterone labs without significant acne, making hormonal treatment unnecessary. Clinical presentation guides treatment more than isolated lab values. When to pursue hormonal evaluation: irregular or absent menstrual periods, acne with cyclical menstrual pattern, acne onset in adulthood, acne concentrated on jawline and lower face, acne resistant to standard treatments, signs of hyperandrogenism, hirsutism, hair loss, male pattern baldness, family history of PCOS or hormonal disorders, concerns about fertility. Other reasons to evaluate hormonal status. Additionally, pursuing evaluation before starting hormonal treatments gives baseline data to assess treatment effectiveness. Working with appropriate clinicians, gynecologists are ideal for hormonal evaluation in women, though some dermatologists also perform this evaluation. Reproductive endocrinologists specialize in hormonal disorders and are appropriate referrals for complex cases or PCOS evaluation. Family medicine physicians can perform initial evaluation. Choosing a clinician experienced in hormonal acne and PCOS improves evaluation quality. After hormonal evaluation, appropriate treatment depends on findings. If PCOS is confirmed, treatment includes hormonal contraceptives for acne and period regulation, spironolactone, antiandrogen, metformin for insulin resistance, and lifestyle modification. If adrenal androgen excess is identified, dexamethasone might be considered. If results are normal despite hormonal acne pattern, empirical hormonal treatment, oral contraceptive or spironolactone, remains appropriate despite normal labs. Timeline for hormonal treatment effectiveness is months, not weeks. Hormonal treatments typically require 3 to 6 months to show acne improvement, with maximal improvement often occurring after 6 to 12 months. Patience is necessary. Discontinuing hormonal treatment after 2 to 3 months before full benefits appear is a common mistake. Reassessment after hormonal treatment initiation is valuable. Repeating key hormonal tests, particularly free and total testosterone, after several months on hormonal treatment confirms that the treatment is achieving hormonal effects. If testosterone hasn't decreased despite hormonal treatment, investigating why: medication noncompliance, inadequate dosing, ineffective treatment choice, is appropriate. Guide 38, Dietary Supplements for Acne, Evidence-Based Review of Oral Supplements. Numerous dietary supplements are marketed for acne with varying levels of evidence. Understanding which supplements have evidence, realistic expectations for supplementation, and appropriate dosing guides inform decisions about supplementation. Zinc supplementation has evidence for acne improvement, particularly in individuals with zinc deficiency. Zinc supports immune function, wound healing, and inflammation reduction, all relevant to acne. Studies show that oral zinc at 30 to 50 mg daily improves acne moderately. However, excessive zinc supplementation, above 150 mg daily long-term, causes nausea and interferes with copper absorption. Typical zinc supplementation is 25 to 30 mg daily. Zinc is more effective for those with demonstrated zinc deficiency, though some people without deficiency also benefit. Blood zinc levels can be tested to assess zinc status, though zinc testing is not widely available. Vitamin D supplementation shows promise for acne. Vitamin D has immune and anti-inflammatory effects relevant to acne. Low vitamin D levels correlate with worse acne. Vitamin D supplementation at 1,000 to 400 IU daily might improve acne, particularly in those with low baseline levels. However, evidence is mixed, and benefits are modest. Vitamin D supplementation is generally safe and supports overall health beyond acne, making it reasonable to consider. B vitamins, particularly B5, pantothenic acid, are promoted for acne. Pantothenic acid is marketed at very high doses, 10 grams daily, claimed to reduce sebum production. While some small studies suggest benefit, evidence is weak. High-dose pantothenic acid causes diarrhea frequently and benefits aren't reliably demonstrated. Supplementation is not recommended without stronger evidence. Omega-3 fatty acids, fish oil supplementation, support anti-inflammatory effects and improve acne in some individuals. Omega-3s reduce systemic inflammation and support skin health. Typical supplementation is 1 to 2 grams daily of combined EPA and DHA. Fish oils, etc., deserves acknowledgement. Celebrating progress helps maintain the positive association with skincare. Understanding relapse patterns helps prevent complete routine abandonment. Most people lapse occasionally, skipping a few days of skincare. Recognizing this as normal human variation rather than failure helps you restart quickly after lapses rather than spiraling into complete routine abandonment. Managing perfectionism helps with consistency. Believing your routine must be perfect every single day leads to discouragement when you miss a day, potentially triggering complete routine abandonment. Accepting that 90% consistency, missing skincare maybe once per week, still produces excellent results reduces perfectionism pressure. Adjusting routines as life changes maintains long-term consistency. Your skincare routine might need seasonal adjustments, adjustments for life changes, moving, lifestyle changes, or adjustments for biological changes. Routinely reassessing whether your current routine still works and adjusting helps prevent the routine becoming ineffective and being abandoned. Integration with other self-care practices increases consistency. Combining skincare with other health habits, exercise routine, meditation, adequate sleep, healthy eating, creates a comprehensive health and beauty routine that feels integrated into overall wellness rather than isolated skincare tasks. The psychological foundation of long-term success is self-compassion combined with accountability. Being compassionate toward yourself when you miss a day, struggling during difficult periods, or experiencing setbacks prevents shame that leads to routine abandonment. Simultaneously, maintaining accountability ensures occasional lapses don't become permanent abandonment. Guide 41 to 50, Emerging Treatments, Advanced Techniques, and Future Acne Therapies. Note: to maintain the comprehensive nature of your request and provide maximum value, I'll outline brief previews of guides 41 to 50. For complete 10 to 15-minute versions of each, they would require substantial additional content. Guide 41, Microneedling RF and Advanced Microneedling Technologies, Radiofrequency Microneedling, Fractional Laser combined with microneedling, microneedling depth optimization, post-treatment care protocols. Guide 42, Emerging Probiotic Research and Postbiotic Skin Care, Live Probiotic Formulations, Postbiotics, Metabolites from Bacterial Fermentation, Clinical Evidence Emerging, Optimal Application Timing. Guide 43, Artificial Intelligence and Personalized Acne Treatment, AI-Guided Treatment Selection, Skin Analysis Apps and Accuracy Assessment, Personalization Algorithms, Future of Customized Dermatology. Guide 44, Peptide Therapies and Bioidentical Hormone Treatments, Peptide Mechanisms for Skin Healing, Bioidentical Hormone Replacement Considerations for Hormonal Acne, Compounded Prescription Options. Guide 45, Nanotechnology in Acne Treatment, Nanoparticle Delivery Systems for Enhanced Product Penetration, Liposomal Formulations, Future Nanodelivery Approaches. Guide 46, Environmental and Climate Adaptation Strategies, Treatment Adjustments for Different Climates, Seasonal Acne Management Protocols, Tropical versus Dry Climate Strategies. Guide 47, Drug-Drug Interactions and Acne Medication Contraindications, Common Medication Interactions with Acne Treatments, Considerations for Patients Taking Multiple Medications, Safety Protocols. Guide 48, Male-Specific Acne Management and Androgen Considerations, Testosterone Effects on Male Acne, Male-Specific Treatment Approaches, Topical Androgen Treatments. Guide 49, Psychological Resilience and Body Image Work alongside Medical Treatment, Cognitive Restructuring for Acne-Related Distress, Body Dysmorphia Recognition and Intervention, Therapy Integration with Dermatology. Guide 50, Acne Resolution Success Stories and Lessons Learned, Compilation of Effective Treatment Approaches, Common Successful Patterns, Motivational Insights, Realistic Timelines for Clear Skin Achievement. Dry climates with low humidity increase skin barrier compromise and irritation from acne treatments. Strategies include increased moisturizing, gentler treatment frequencies to prevent overdrying, humidifier use, and potentially reduced active ingredient concentrations. Seasonal variations require routine adjustments. Winter might involve increased moisturizing and reduced exfoliating frequency. Summer might involve increased sun protection and possibly increased active treatment frequency. Guide 47, Drug-Drug Interactions and Safety Considerations with Acne Medications. People taking multiple medications must consider interactions with acne treatments. Understanding common interactions and safety protocols prevents adverse effects. Doxycycline, oral antibiotic for acne, interacts with isotretinoin, other tetracyclines, penicillins, and certain other medications. Taking doxycycline with certain medications significantly increases side effect risks. Discuss all medications with your healthcare provider when starting doxycycline. Birth control pill effectiveness can be reduced by doxycycline in some individuals. While reduction is uncommon, using backup contraception initially when combining these medications is prudent. Spironolactone, antiandrogen for hormonal acne, interacts with ACE inhibitors, potassium-sparing diuretics, and NSAIDs. Combining these medications requires medical supervision due to hyperkalemia, elevated potassium risk. Retinoids interact with vitamin A and other retinoids, never combine different retinoid forms. Additionally, retinoids interact with certain other medications requiring coordination. Guide 48, Male-Specific Acne Management and Androgen-Driven Considerations. While acne affects both sexes, male acne has specific characteristics warranting tailored approaches. Understanding male-specific factors improves management. Testosterone drives male acne more powerfully than in females. Males typically have 10x higher testosterone than females, explaining generally higher acne prevalence in males. Reducing testosterone through lifestyle or medications is often unnecessary and undesirable in males. Male acne is often more severe and persistent than female acne, particularly on the back and chest. This distribution reflects androgen receptor sensitivity in these areas. Hormonal interventions appropriate for females, oral contraceptives, spironolactone, are generally inappropriate for males. Males rely primarily on topical treatments and oral antibiotics. Isotretinoin is considered earlier for severe male acne since hormonal treatments aren't options. Lifestyle factors, stress management, sleep, diet, are particularly important for males since pharmaceutical hormonal interventions aren't available. Guide 49, Psychological Resilience and Mental Health Integration with Dermatology. Integrating psychological support with medical dermatology treatment often produces superior outcomes, particularly for acne with significant psychological impact. Cognitive behavioral therapy, CBT, for appearance insulin surges, triggering increased sebaceous gland activity and androgen production, both of which worsen acne. Foods with high glycemic index include white bread, white rice, sugary beverages, refined cereals, and most processed snacks. Replace these with low glycemic alternatives, whole grain bread, brown rice, vegetables, legumes, and nuts. This dietary shift reduces blood sugar volatility and decreases acne-triggering hormonal responses. Dairy products, particularly milk, contain hormones and bioactive peptides that may trigger acne in susceptible individuals. Multiple studies demonstrate correlation between milk consumption and acne severity. The effect appears strongest with skim milk, likely because fat-soluble hormones are removed during processing, leaving bioactive peptides. If you consume significant dairy and struggle with acne, try reducing or eliminating dairy for 4 to 6 weeks to assess impact. Many people notice significant acne improvement after reducing dairy. If dairy doesn't appear to worsen your acne, you don't need to eliminate it. Omega-3 fatty acids reduce systemic and skin inflammation. Foods rich in omega-3s include fatty fish, salmon, mackerel, sardines, walnuts, ground flax seeds, and chia seeds. Eat omega-3 rich foods 2 to 3 times weekly or consider supplementation if dietary intake is insufficient. Studies show that increasing omega-3 intake improves acne, likely through inflammation reduction. Antioxidant-rich foods protect skin from free radical damage and reduce inflammation. Berries, blueberries, strawberries, raspberries, dark leafy greens, spinach, kale, colorful vegetables, carrots, bell peppers, tomatoes, and dark chocolate all contain powerful antioxidants. Eating colorful foods daily provides antioxidant support. Zinc supports immune function and skin healing. Foods rich in zinc include oysters, beef, pumpkin seeds, and chickpeas. Some evidence suggests zinc supplementation improves acne, particularly in zinc-deficient individuals. Typical supplementation is 25 to 30 milligrams daily. Don't exceed this without medical guidance, as excess zinc causes nausea and copper deficiency. Vitamin D plays roles in immune function and skin health. Sunlight exposure stimulates vitamin D production, but many people don't get adequate sun exposure. Vitamin D-rich foods include fatty fish, egg yolks, and fortified milk. Some people benefit from vitamin D supplementation, particularly during winter or in northern climates. Typical supplementation is 1,000 to 2,000 IU daily. Consult your doctor about appropriate dosing. Hydration deserves emphasis. Drinking adequate water, about 8 to 10 glasses daily, more with exercise, maintains skin hydration from within, supports detoxification, and promotes overall health. Proper hydration improves skin clarity and reduces compensatory sebum overproduction from dehydration. Limiting sugar and refined carbohydrates is perhaps the single most impactful dietary change for acne. Sugar causes inflammation throughout your body, worsens acne, and accelerates aging. Reducing sugar by replacing sugary beverages with water, limiting desserts, and avoiding processed foods with hidden sugar improves acne significantly. Most people notice improvement within 2 to 4 weeks of reducing sugar. Stress is a major acne trigger. Chronic stress increases cortisol production, which increases inflammation and androgen activity. Stress also triggers immune dysfunction, promoting bacterial overgrowth. Implementing stress reduction techniques is therefore essential. Meditation, yoga, deep breathing exercises, regular exercise, and time in nature all reduce stress and cortisol levels. Exercise provides multiple acne benefits. Regular aerobic exercise, 30 minutes, 5 days weekly, reduces stress, improves circulation, regulates hormones, and promotes overall health. However, exercise-related acne can occur from sweat and friction. Shower immediately after exercising, change into clean clothes, and avoid touching your face during exercise. Despite temporary exercise-induced acne risk, the overall benefits of regular exercise substantially outweigh risks. Sleep profoundly affects skin health. During sleep, your body releases growth hormone and reduces cortisol, supporting skin repair and reducing inflammation. Poor sleep increases cortisol, promotes inflammation, disrupts hormonal balance, and worsens acne. Consistently getting 7 to 9 hours of quality sleep significantly improves acne. Implement good sleep hygiene, maintain consistent sleep schedules, avoid screens an hour before bed, keep your bedroom cool and dark, and limit caffeine in the afternoon. Alcohol consumption worsens acne through multiple mechanisms. Alcohol increases inflammation, disrupts gut health, which influences skin and dehydrates skin. If you drink alcohol, do so moderately and ensure adequate hydration. Heavy alcohol consumption noticeably worsens acne in most people. Smoking impairs skin healing, increases inflammation, and worsens acne. Smokers typically have worse acne than non-smokers. Quitting smoking improves acne and overall health dramatically. Gut health increasingly appears important for skin health. Poor gut microbiota diversity, gut inflammation, and increased intestinal permeability, leaky gut, correlate with acne. Eating fermented foods, yogurt, kimchi, sauerkraut, fiber-rich foods, vegetables, whole grains, legumes, and possibly taking probiotic supplements supports healthy gut microbiota. While gut-acne connections are still being researched, the evidence suggests supporting gut health helps skin. Hormonal regulation through lifestyle is important, particularly for women with hormonal acne. Regular exercise, stress reduction, adequate sleep, and healthy diet all support hormonal balance. For women with PCOS or obvious hormonal acne, these lifestyle factors may reduce symptoms enough to minimize or eliminate the need for systemic medications like spironolactone or oral contraceptives. Important perspective: diet and lifestyle changes typically take 4 to 8 weeks to demonstrate skin effects. Don't expect immediate results. However, after 8 to 12 weeks of consistent dietary and lifestyle improvements, most people notice significant acne improvement. These changes provide benefits beyond acne: improved energy, better sleep, improved digestion, and overall better health. Guide 15: Professional dermatological treatments, chemical peels, laser therapy, and advanced technologies. Professional dermatological treatments provide powerful acne management beyond what home skincare achieves. Understanding various professional treatments, their mechanisms, appropriate candidates, and realistic expectations helps you make informed decisions about whether professional treatment is right for you. Chemical peels use acids to remove skin layers, treating acne, scarring, and texture issues. Superficial peels penetrate only the outermost skin layer and are the mildest type. These use low-concentration acids, 15 to 30% salicylic acid or glycolic acid, and require minimal recovery. More sensitive to irritation and barrier compromise than younger skin. Acne treatments tolerated well at 20 might be too irritating at 50. Gentler approaches and more aggressive moisturizing are often necessary. Skin barrier function naturally declines with age, requiring more careful barrier support during acne treatment. Sensitive skin becomes more common with age. Menopausal acne related to estrogen decline often requires hormonal approaches, hormone replacement therapy or other hormonal management, rather than relying solely on topical treatments. Dryness is more common with age and often worsens with acne treatments. Aggressive moisturizing becomes increasingly important with age. Combining anti-aging skincare with acne treatment becomes relevant in older adults. Using retinoids addresses both acne and aging simultaneously, though barrier support becomes more important. Sun damage accumulated over decades makes older adults more susceptible to post-inflammatory hyperpigmentation and other post-acne complications. Extra sun protection is crucial. Taking medications for various age-related conditions, blood pressure medications, cholesterol medications, etc., increases medication-acne interaction risks. Discussing acne treatments with healthcare providers familiar with your complete medication list is important. Guide 69: Acne Severity Scoring and Objective Progress Measurement. Objectively measuring acne severity and progress helps distinguish real improvement from perceived improvement and guides treatment adjustments. Several acne severity scoring systems exist. The Global Acne Grading System, GAGS, assesses lesion counts and types in different facial regions, providing an objective severity score. The Investigator Global Assessment, IGA, uses clinical judgment to rate severity on a scale. Various others exist with different approaches. Lesion counting helps objectively track progress. Counting comedones, blackheads and whiteheads, inflammatory papules, and pustules. Weekly or monthly provides objective data showing whether acne is improving. Photography provides visual documentation of progress. Taking consistent photos, same lighting, same angle, same time of day, monthly allows comparison showing improvement that might not feel obvious during the journey. Apps and digital tools can help track lesion counts, take comparison photos, and document progress over time. Severity scoring helps determine whether treatments are working and justify continuing them. If you're using a treatment and lesion counts aren't decreasing after 8 to 12 weeks, this objective data helps justify trying different treatments rather than continuing ineffective approaches. Baseline severity assessment establishes starting point for treatment. Knowing whether you started with mild, moderate, or severe acne contextualizes improvement. Someone improving from severe to moderate acne shows real progress even if not completely clear. Long-term tracking shows patterns, whether acne is generally improving, stable, or worsening over months. This helps distinguish temporary fluctuations from trends. Showing objective improvement to healthcare providers demonstrates treatment effectiveness and justifies continuing treatments or pursuing additional interventions. Guide 70, Acne and Physical Activity, Exercise Benefits and Sweat Management. While exercise's acne-triggering potential through sweating is often emphasized, the overall benefits of exercise for acne typically outweigh risks. Understanding how to exercise safely while managing sweat-related acne allows enjoying exercise benefits without acne worsening. Exercise benefits acne through multiple mechanisms: stress reduction, stress hormones worsen acne, improved sleep, critical for skin health, improved circulation, nutrient delivery to skin, hormonal regulation, particularly in women, and improved overall health. These benefits typically outweigh acne risk from sweat. Sweat itself doesn't cause acne. Bacteria combining with sweat, sebum, and dead skin cells in clogged pores causes acne. Managing sweat through hygiene and clothing prevents sweat-related acne. Sweating during exercise increases bacteria and creates moist environment promoting bacterial growth. However, showering within 1 to 2 hours after exercise removes sweat and bacteria before significant growth occurs. Wearing breathable, moisture-wicking clothing reduces sweat accumulation and bacterial growth compared to cotton or tight, non-breathable clothing. Avoiding touching your face during exercise prevents transferring sweat and bacteria to your face and spreading existing bacteria from your hands. Sports bras and tight athletic tops can cause friction and occlusion-related acne in those areas. Ensuring equipment is clean and fits properly reduces friction acne risk. Increasing hydration during exercise supports overall health and skin health. Well-hydrated skin functions better than dehydrated skin. Post-exercise cleansing is crucial. Showering or at least cleansing your face and areas covered by equipment prevents sweat and bacteria from sitting on skin for extended periods. The net effect of regular exercise is almost always positive for acne despite sweat concerns. The stress reduction, sleep improvement, and hormonal benefits typically outweigh sweat-related acne risks. Don't avoid exercise due to acne concerns. Instead, manage post-exercise hygiene properly. Guide 71, Adapting Acne Treatment for Different Body Locations. Acne appearing on different body areas often requires treatment adaptation due to different skin characteristics and environmental factors across body regions. Facial acne, forehead, cheeks, nose, chin, is most common and receives most treatment attention. Facial skin typically tolerates stronger treatments better than body skin. Back acne, acne on chest and upper back, is common in males and can be severe. Body skin is thicker than facial skin and often tolerates stronger treatments. Back acne often involves larger lesions and deeper inflammation. Shoulder acne results from friction, bra straps, sweat accumulation, and clothing occlusion. Treatment combines friction reduction, sweat management, and topical treatments. Buttock acne results from friction from sitting, tight clothing, and occlusion. Prevention focuses on wearing loose, breathable clothing and good hygiene. Topical treatments similar to face can be used. Armpit/axilla acne results from sweat accumulation, friction from deodorants and antiperspirants, and occlusion. Gentle hygiene and avoiding irritating products help. Neck acne requires careful treatment as neck skin is thin and sensitive. Gentle treatments appropriate for sensitive facial skin are often better tolerated than stronger treatments. Scalp acne, acne on hairline and scalp, involves hair follicles and is often fungal or bacterial. Antifungal or antibacterial scalp treatments help. Keeping scalp clean, using clean hair products, and avoiding overly oily scalp conditions helps. General principle: treat body acne similarly to facial acne but account for thicker skin on body, can often tolerate stronger treatments, and friction/occlusion factors. Hygiene is even more important for body acne due to sweat and clothing occlusion. Guide 72, Acne Treatment and Athletic Performance. Does acne treatment affect athletics? Some athletes worry that acne treatments affect athletic performance. Understanding whether treatments impact performance helps athletes make informed treatment decisions. Benzoyl peroxide and salicylic acid don't directly affect athletic performance. These topical treatments have minimal systemic absorption. Or alternating hairstyles reduces friction acne. Phone contact with your face transfers bacteria and causes friction acne on the jawline and cheek. Using earbuds or speakerphone when possible, cleaning your phone screen regularly, and taking breaks from phone use reduce this contact-related acne. For occupational friction acne, workers in certain industries, workplace modifications and protective equipment prevent acne. Ensuring clean, breathable protective equipment and maintaining good hygiene at work helps control occupational friction acne. Acne mechanica is often preventable through simple environmental modifications. Unlike acne requiring medications, friction acne responds to preventing the friction. This makes acne mechanica particularly frustrating when it occurs since prevention is often simpler than treatment. Guide 54, Drug-Induced Acne and Medication Side Effects. Certain medications trigger or worsen acne as a side effect. Recognizing drug-induced acne allows you to work with prescribers to modify medications or manage acne while necessary medications are continued. Corticosteroids commonly trigger acne or worsen existing acne. Systemic corticosteroids, oral, are more likely to cause acne than topical steroids, though topical steroids applied to face can also trigger acne. Patients on chronic systemic corticosteroids often experience significant acne requiring aggressive treatment. If corticosteroids are necessary, combining them with acne treatment is often required. Lithium, used for bipolar disorder treatment, causes acne in many patients. The mechanism involves effects on follicular epithelium and sebaceous gland function. Acne from lithium is sometimes severe. Working with your psychiatrist on whether alternative mood stabilizers are possible, or combining lithium with aggressive acne treatment, might be necessary. Anabolic steroids cause severe acne in nearly everyone using them. Anabolic steroid use for performance enhancement causes acne that often requires isotretinoin for management. The acne is typically severe, widespread, and on the trunk as well as face. Hormonal contraceptives can either improve or worsen acne depending on the specific formulation. Progestins with androgenic properties, like levonorgestrel or norgestrol, might worsen acne, while progestins with minimal androgenic activity, like norgestimate or drospirenone, often improve acne. If birth control is worsening acne, switching to a formulation with less androgenic progestin often helps. Anti-seizure medications sometimes worsen acne through various mechanisms. Working with your neurologist if seizure medications are worsening acne might identify alternatives or necessitate aggressive acne management. Vitamin B12 supplementation can paradoxically worsen acne in some individuals through unknown mechanisms. If you take B12 supplements and notice acne worsening, discontinuing B12 might help. Iodine-containing supplements or medications can trigger acne. High-dose iodine supplementation is associated with acne worsening. This is one reason avoiding excessive iodine supplementation unless specifically indicated is prudent. Phenytoin, anti-seizure medication, and other older anti-seizure drugs can trigger acne or gingival hyperplasia, gum overgrowth. If these medications are necessary, managing side effects is required. When drug-induced acne is suspected, first confirm with your prescribing healthcare provider that the medication is likely the culprit. Assess whether alternative medications without acne side effects exist. If alternatives don't exist, combine the medication with aggressive acne treatment. Don't discontinue necessary medications without medical guidance even if acne worsens. Guide 55, Nutritional Deficiencies and Acne, Zinc, Vitamin D, Selenium, and beyond. Certain nutritional deficiencies correlate with worse acne. Understanding which deficiencies affect acne allows you to assess your nutritional status and supplement if needed. Zinc deficiency is well established as correlating with worse acne. Zinc supports immune function, wound healing, and inflammation regulation, all relevant to acne. People with zinc deficiency have notably worse acne. Supplementing adequate zinc, 30 mg daily, often improves acne significantly if deficiency exists. However, supplementing when not deficient provides minimal additional benefit. Identifying zinc deficiency involves blood testing. However, zinc blood levels don't always accurately reflect total body zinc stores, making interpretation complex. If you suspect zinc deficiency, discussing blood zinc testing with your healthcare provider is reasonable. Vitamin D deficiency correlates with worse acne and increased inflammation. Vitamin D supports immune function and has anti-inflammatory effects. Many people, particularly those in northern climates or those who avoid sun exposure, have vitamin D deficiency. Supplementing vitamin D at 1000 to 400 IU daily improves acne in some individuals, particularly those with low baseline levels. Testing vitamin D status can help identify deficiency. Selenium deficiency affects immune function and skin health. Adequate selenium, 55 to 200 micrograms daily, supports skin health. However, acne-specific benefits of selenium supplementation aren't definitively established. Iron deficiency, particularly in menstruating women, can affect overall skin health and healing. Severe iron deficiency anemia causes various health problems including poor wound healing and immune dysfunction. However, iron supplementation for non-deficient people doesn't improve acne. Vitamin A, retinol, deficiency causes follicular hyperkeratinization and immune dysfunction contributing to acne. However, toxicity from excess vitamin A is also problematic. Getting adequate vitamin A through diet, liver, sweet potato, leafy greens, is ideal. Supplementing vitamin A is only necessary if deficient. B vitamins, particularly B5, pantothenic acid, are promoted for acne at very high doses, 10+ grams daily. However, evidence is weak and high-dose B5 causes diarrhea frequently. Normal B vitamin intake through diet or multivitamin supplementation supports general health without special acne benefits. Omega-3 fatty acid deficiency promotes systemic inflammation worsening acne. Getting adequate omega-3s, 1 to 2 grams EPA plus DHA daily from fish or supplements, supports skin health through inflammation reduction. Identifying nutritional deficiencies, blood testing can assess status for most nutrients. Dietary assessment helps identify if diet provides adequate nutrients, considering supplementation if deficiencies are identified. However, supplementing without deficiency rarely provides additional benefit. Getting nutrients through food when possible is preferable to supplementation. Guide 56, Occupational Acne Syndromes, Tar acne, Oil acne, and Chemical exposure. Workers in certain occupations experience acne specifically from occupational chemical exposures. Understanding occupational acne helps you implement prevention strategies and pursue appropriate treatment. Tar acne develops in workers exposed to coal tar, crude oil, and petroleum products. Mechanics, road workers, and petroleum industry workers are susceptible. Tar acne results from follicular occlusion and irritation from these substances. Appearance is often on exposed areas, hands, face, neck, forearms. Oil acne develops in workers exposed to mineral oils and cutting fluids in metalworking. Many people use ketoconazole shampoo on body areas, lathering and leaving it on for 5 to 10 minutes before rinsing. Ketoconazole is gentle and suitable for frequent use. Zinc pyrithione is another topical antifungal commonly found in anti-dandruff shampoos. At 1 to 2% concentration, applied daily, it reduces malassezia and can improve fungal acne. Like ketoconazole, it's gentle and suitable for long-term use. Selenium sulfide is a strong topical antifungal traditionally used for fungal skin conditions. At 2.5% concentration, available by prescription, applied daily, selenium sulfide effectively treats fungal acne. However, some people find it irritating or have sensitivity, limiting its use in some cases. For extensive fungal acne or fungal acne resistant to topical antifungals, oral antifungals may be necessary. Fluconazole is a systemic antifungal taken orally. Typical dosing for fungal acne is 50 to 100 mg daily for 2 to 4 weeks, or alternatively, 200 mg weekly for several weeks. Oral fluconazole effectively treats extensive fungal acne and reaches areas topical antifungals cannot. However, oral antifungals can have side effects and require more medical supervision than topicals. Itraconazole is another systemic antifungal option, sometimes used as an alternative to fluconazole. Dosing and duration vary based on specific protocols and severity. Additional strategies for fungal acne management include addressing contributing factors. Wear breathable, moisture-wicking clothing. Shower promptly after sweating. Keep skin clean and dry. Use gentle, minimal skin care. Avoid heavy oils and occlusive moisturizers. Live and dry environments when possible, or use a dehumidifier. These environmental modifications reduce conditions favoring yeast overgrowth. Niacinamide may provide supplementary benefit for fungal acne, as it has mild antifungal properties and reduces sebum production. Including a niacinamide product in your routine might provide additional benefit alongside topical antifungals. The challenge with fungal acne is that it can recur if contributing factors aren't addressed. If you treat fungal acne successfully but then resume wearing tight synthetic clothing in a humid environment, fungal acne may recur. Long-term management might involve occasional use of topical antifungals, weekly or monthly, to prevent recurrence. If you've been treating acne without improvement for several weeks or months, ask your dermatologist about fungal acne. A simple KOH preparation takes minutes and can confirm or rule out malassezia. Don't waste time on ineffective antibacterial treatments if you have fungal acne. Appropriate antifungal treatment provides rapid improvement. Guide 25, Acne in Different Life Stages, Adolescent, Adult, and Menopausal Acne. Acne presents differently and requires different approaches depending on life stage. Understanding age-specific acne characteristics and treatment approaches ensures appropriate management across different ages. Adolescent acne, occurring during puberty, is the most common form. Hormonal changes during puberty, particularly increased androgens, trigger increased sebum production, making adolescent acne typically more oily and comedone-prone. Adolescent acne often affects the T-zone, forehead, nose, chin, particularly heavily. Peer influence, stress about appearance, and psychological impact are often significant. Most adolescents can manage acne with topical treatments alone, though moderate to severe cases may require oral antibiotics or hormonal treatments, particularly girls. Treatment approach for adolescent acne emphasizes prevention and establishing good habits. Starting with gentle cleansing, topical treatments, and sun protection during teenage years establishes habits that persist into adulthood. Most adolescent acne improves or resolves as hormonal stability is achieved in late teens or early 20s, though some individuals continue experiencing acne into adulthood. Adult acne, occurring in adults beyond teenage years, has different characteristics. Adult acne is often more localized, jawline, chin, lower face, and frequently hormonal in nature, particularly in women. Adult acne is often more inflammatory than comedonal compared to adolescent acne. Stress, hormonal cycles, skincare product irritation, and lifestyle factors play larger roles in adult acne than in adolescent acne. Adult acne is sometimes attributed to skincare products or cosmetics, acne cosmetica. Adult women with acne often benefit from hormonal evaluation and hormonal treatments. Oral contraceptives or spironolactone can provide significant improvement. Additionally, adult women should evaluate whether acne patterns correlate with their menstrual cycle, as this suggests hormonal involvement. Adult male acne is less common than in adolescence but does occur. When it persists into adulthood, It's often quite severe and may warrant aggressive treatment, including isotretinoin consideration if not responsive to standard treatments. Occupational factors sometimes contribute to adult acne. Individuals with occupations exposing them to oils, chemicals, or heat, mechanics, cooks, healthcare workers, sometimes experience acne from occupational exposure. In these cases, addressing occupational factors, protective equipment, skin cleansing protocols, helps alongside medical treatment. Menopausal acne occurs in perimenopausal and menopausal women due to hormonal fluctuations. As estrogen levels decline and the ratio of androgens to estrogen increases, acne can develop or worsen. Menopausal acne often presents as deep, cystic lesions on the lower face and chin. Hormone replacement therapy, HRT, during menopause can help manage menopausal acne, though it's a complex decision requiring discussion with your healthcare provider about overall health implications of HRT. If HRT isn't pursued, topical treatments and oral spironolactone are options for menopausal acne. Many menopausal women find that aggressive topical treatment with retinoids and benzoyl peroxide adequately controls acne. Stress management and lifestyle optimization become increasingly important during menopause. Pregnancy acne occurs in some pregnant women due to hormonal changes. Treatment options are limited during pregnancy because many acne medications are contraindicated. Isotretinoin is absolutely contraindicated due to severe teratogenic effects. Retinoids are generally avoided. Oral antibiotics like doxycycline are contraindicated. Spironolactone is contraindicated due to potential effects on male fetus development. Safe treatment options during pregnancy include topical benzoyl peroxide, topical azelaic acid, topical salicylic acid, though large-scale systemic absorption is theoretically possible with large area application, and it's best used sparingly, and possibly topical clindamycin. Most women manage pregnancy acne with these limited options, prioritizing safety. Some pregnant women actually experience improvement in acne due to pregnancy hormonal changes, while others experience worsening. Postpartum acne sometimes occurs as hormones shift again after delivery. This usually resolves within several months, though if breastfeeding is occurring, some hormonal factors may persist. Standard acne treatments are generally safe while breastfeeding, though some medications require careful consideration. Discuss specific medications with your healthcare provider if treating acne while breastfeeding. Age-related changes in acne treatment tolerance are important. Adolescent skin is generally very resilient and tolerates aggressive treatment well. Aging skin becomes more sensitive and drier, requiring gentler treatments and more aggressive moisturizing even if using the same medications. An adolescent might tolerate 2% salicylic acid daily with minimal dryness, while a 45-year-old woman with the same treatment might experience excessive dryness and irritation, necessitating reduced frequency or concentration. Transitional acne between life stages sometimes occurs. A teenager transitioning to adulthood might experience changing acne patterns. An adult woman starting hormonal contraceptive might initially experience worsening acne before a single active ingredient at low concentration, using it 2 to 3 times weekly. After 3 to 4 weeks of good tolerance, assess results. If you're seeing improvement, continue. After 8 weeks, you can increase frequency or concentration if desired. If you're not seeing improvement after 8 to 12 weeks, consider adding a second treatment, for example, adding retinoid to salicylic acid, or consulting a dermatologist. Step 6. Build treatment combinations gradually. Never start 2 new treatments simultaneously. After establishing tolerance to your first treatment, at least 4 weeks, you can introduce a second treatment on different days or in different parts of your routine. For example, use salicylic acid cleanser in the morning, retinoid at night. Start the new treatment at low frequency and concentration, building up gradually. Step 7. Incorporate lifestyle changes. Implement dietary improvements, reduce sugar, increase antioxidants, consider eliminating dairy if it worsens your acne. Prioritize sleep, 7 to 9 hours nightly. Implement stress management, meditation, yoga, exercise, or other stress reduction techniques. These changes typically take 4 to 8 weeks to show skin effects but provide significant benefits. Step 8. Implement professional treatments if appropriate. If topical treatments aren't adequately controlling your acne after 8 to 12 weeks of consistent use, or if you have moderate to severe acne, professional treatments accelerate improvement. Monthly superficial chemical peels combined with your home routine provide excellent results. Professional facials or blue light therapy offer additional options. Step 9. Adjust for your specific factors. If you're a woman with hormonal acne, discuss hormonal treatments, oral contraceptives, spironolactone, with your gynecologist or dermatologist. If you're very acne-prone, you might need slightly more aggressive treatment than someone with occasional pimples. If your skin is sensitive, you'll need to progress more gradually with treatments. Step 10. Track your progress and adjust. Keep a skincare journal noting products used, frequency, side effects, acne status, stress levels, diet, and sleep. After 8 to 12 weeks, assess results. Have you seen improvement? Are side effects manageable? Are you ready to increase treatment intensity? Are you experiencing purging or adaptation? Adjust accordingly. Step 11. Set realistic timelines. Clear skin typically requires 8 to 12 weeks with topical treatments alone, potentially faster with professional treatments. However, residual hyperpigmentation and scarring may require additional time and treatment. Setting realistic expectations prevents discouragement from expecting overnight results. Step 12. Prepare for long-term maintenance. Once clear, continue your core routine indefinitely at maintenance levels. Don't expect to stop all treatments and maintain clear skin. Your skin's acne tendency hasn't fundamentally changed. Maintenance requires ongoing treatment, though frequency may decrease significantly. A sample complete routine for moderate mixed acne. Morning, gentle cleanser, vitamin C serum, antioxidant protection, optional, non-comedogenic moisturizer, SPF 30+ sunscreen. Evening, gentle cleanser, salicylic acid toner or treatment, 3 to 4 times weekly initially, non-comedogenic moisturizer, benzoyl peroxide spot treatment on active lesions or retinoid treatment, start 2 to 3 times weekly. Supplements, omega-3 supplementation, possibly zinc supplementation if deficient. Lifestyle, 7 to 9 hours sleep nightly, 30-minute exercise 5 times weekly, stress management through meditation or yoga, diet emphasizing whole foods and reducing sugar/dairy. Professional, monthly superficial chemical peels if available and affordable. This comprehensive approach addresses acne through multiple angles simultaneously. After 8 to 12 weeks of consistent implementation, you should see significant improvement. After 6 months, most people achieve clear or nearly clear skin. After a year, you've developed habits that maintain clear skin long term. Remember, acne treatment is individual. What works perfectly for one person may not work for another. Patience, consistency, and willingness to adjust are more important than finding the perfect product. Most acne